Good morning. How are you? Can you hear me?
I can hear you. I was just trying to figure out how to get you on my headset.
Hi, Ariana.
Good morning.
Good morning. All right, Teresa, do you have me on your headset? Teresa?
Yes, ma'am.
Okay. Okay. Do you guys have your HESI preps? Okay. Let's start with what questions you have on your HESI prep. These are obviously topics that are going to be covered on your HESI, or concepts, topics. I don't know what the questions are, obviously. HESI is done through a kind of like NCLEX through a bank. Okay. Looking back, you can see what topics they cover. And so these are the topics that have been covered in past HESIs. So as you were working on your assignment all term and completing this assignment, this was also hopefully a helpful tool for you to prepare for HESI. Okay, this is what you need to focus on. This assignment. Okay, that's why we introduced it in week 1, so that you would be keeping up with it throughout the term. And as we covered concepts in class, you could be completing this, looking through the scope of the nursing process, right? Remember, it's clinically focused. Okay, this has a lot of med surg information on the HESI, on the community HESI. There's a lot of med surg information, as you can see. Okay, when you're talking about post, let's see, disease management, post cabbage, that's med surg. Post arthroplasty, that's med surg. NG2 feedings at home, med surg. So there's a lot of med surge type questions on here. It seems like there's a lot of topics on elderly. Okay. So this is, you have to bring all your tools. Okay, all the information you've learned in previous classes, especially med surge, geriatrics, pediatrics, right? So what are you guys thinking? What are you guys thinking? Do you have any questions? Anything jump out? And you've done your research for all these topics, right? Does anybody have any particular questions about any of the sections? No? Danielle, hi, good morning. So with regards to anthrax incubation, kind of like we do in our exam reviews, what kind of clinical question do we think we're going to be asked? What do you think?
ABCs.
Sure. ABCs, maybe what are the signs and symptoms of anthrax incubation or anthrax? What's the incubation period? How is it treated? And hopefully this is information you've put in your, now I've corrected the HESI preps. Okay. Did any of you see my message in which I said, or did any of you use the version that was in week 9? So you would have gotten part of your feedback from me in your exam was, good job on filling it out. But please take a look at week 1 and the week 1 posting of the more updated HESI prep. Anybody get that message? Okay, Danielle got it. Okay. Ariana, Teresa, you didn't get that message. Danielle did. So Danielle, I want you to also, this is the updated version. Okay. You were using not the older version because they're really similar, but there were several more boxes to complete in the older version. I took those out 2 terms ago, to make it more reflective of the current HESI. Okay, so I want you to take a look at this one as well. They're very, very similar, but there's a few additional items on this that aren't on the one that you did. Okay, so I tried to make that crystal clear at the very, very beginning of class, and that to use that week 1, but you're fine. I just want to make sure you understood what I meant by that message. So if you got that long message, take a look at the updated version. It's not that different, but there are some additions. Okay. With regards to disasters, lots of things about disaster. Okay. Disaster, what's a level 1, 2, 3? So maybe identify, I'm just trying to think of questions here. Giving
Like
you a
if they ask,
disaster scenario, maybe?
yeah, or like if they're in the crisis statement or like the impact
Yep.
stage of everything. Okay.
Mhm.
And how they triage.
Triage, yeah. response, recovery. Yeah. And then disaster planning. You're going to get asked about disaster planning. I would remember this is clinical setting. So when you're teaching a family about disaster planning, disaster preparedness, what are you teaching them? In
Just
class, we
stop and
talked,
ask.
what?
Oh, I thought you was asking what.
Yeah,
Okay.
no, jump in, jump in. Preparing
That.
that, we talked about that disaster kit,
Hmm.
right?
Right.
Red tag triage. So there's a whole list of tags. You guys should have had that in your in this box. So it's specific to red tags. So know what's red tag?
Immediate threat to life.
Exactly. Okay. Remember, I know it's not in here, but as far as disaster planning, think about disaster communication too. How important disaster communication is, right? That's why we do our disaster drills. Make sure the communication is seamless, making sure, who needs to know about what. What does the community need to know? Who needs to know what? Does everybody need to know all the information? Okay. Then epidemiology. What about the flu? Maybe vaccines? I don't, just thinking out loud here.
Mhm.
Monitoring the flu. Flu, flu vaccines. Same as SARS. What does SARS present with? Again, think clinical. Think you're going to be taking care of a client that has suspected SARS or suspected influenza or suspected COVID. How do you assess that? How do you diagnose it? CDC reportable diseases. I'm not sure if they expect you to know what the CDC reportable diseases are, but I'm thinking they want you to know that certain CDC diseases are reportable. Where do you report them?
The state.
The state.
Mhm.
Start with the state,
Mhm.
right? Your state health department. What's vertical transmission?
Mother or father to offspring.
So here we're talking parent to child. Okay. There's a lot in the health promotion and teaching sections. Where do you get infant death rates? Where do we find those? Infant mortality rates. What did you guys put on your HESI prep about infant death rates, infant mortality rates?
Immunizations and proper car seat placement and screenings for lead. Educate parents on ways to cope with stress.
Okay. You can get, and the other thing is you can get infant death rates from your health department, right? So remember that. Maybe it's going to be asking, where do you get the death rates? Why do we do lipid screening? What kind of client would need a lipid screen? What's going on?
Patients that are either hypertensive, that are obese, that are more sitting down than being more active. They have certain health issues that are, genetics, age.
Yeah. So lipid screening is tied to obesity, right? So why would, yeah. So maybe a question about, maybe you have an obese client and you're doing an evaluation or your assessment. What kinds of labs would you do to assess the obese patient? Right? Recognizing alterations in health. So conjunctivitis, know about that? Okay, diabetes. This is going back to med surg, right? We covered conjunctivitis in community, covered a little bit of diabetes in community. And what about eczema in school sports? What clinical question could we get about eczema with school sports? What do you think?
Something to do with the extra precaution because the sweating can trigger a reaction outbreak.
Yeah, excellent, excellent, excellent. Heart healthy diet. We should be always teaching a heart healthy diet, right? Maybe this is with the cardiac patient. But we should know what a heart healthy diet is, and we should be teaching that. Elder health assessment. What are they going to be asking about elder health assessment? What kinds of things do you assess when you're doing it?
You
Go
would
ahead.
be like you would be checking to see when they did their last vision test. Because it would all like coincide, wouldn't it, with like being like the age to
Sure.
see like hypertension, to see if there's a history of it, to see if they've had their
Yep.
eyes checked, if they're seeing a podiatrist or anything like that.
Mhm. Well, an elder health assessment's pretty broad. And so, yes, Teresa, that's a physical assessment, right? I would also be thinking about some kind of a home assessment. Are they safe in their home? I'd also be thinking about an environmental assessment in their home, right? I would be, now this is of course if we're in the home, right? Elder assessment, if they come in, is probably much more of a physical assessment, right? Maybe a emotional assessment, psychological assessment. But remember, it can also include a safety assessment if you're in the home, environmental assessment in the home. So elder assessment, a very, very broad category. But think of your nursing process and your ABCs.
Professor Marvel, I have to get off. My husband is out of surgery.
Okay.
So I just try to tune it. That's why. So
Oh, yeah. Well, watch the recording.
I will. Thank you.
Best of luck.
Thank you.
Okay.
Bye.
Then school age. What do we want to know about school age? What do we teach the school age kids? What kind of health screenings do we do for the school age kids? One of them is scoliosis. Scoliosis is going to come up, it looks like, on this HESI. So make sure you understand what scoliosis is. Okay, and how do you screen for it? Do you have the kids sitting down or standing up? Standing up.
Standing up.
Yep. And we do vision and hearing screenings. With the adolescents, what do we do for screenings with them? We talk about seatbelt safety. Please, if this isn't in your HESI prep, your completion, please go back and look at the Healthy People 2030 goals for adolescents. There's a question about that. Healthy People 2030 goals for adolescents. Make sure you go back and look at that. And then, and then here comes med surge with your disease management. How do you care for post-cabbage client, post-arthroplasty client? What do we need to think about with NG2 feedings in the home? So this is bringing the med surge in there into this. Patient education. What are breast cancer risks? I mean, hopefully this is all in your HESI prep. We're just reviewing it. An elder home diet. What's a healthy diet? What do we teach the elderly about a healthy home diet?
Make good choices. Eat more vegetables and fruit. Low sodium. Avoid canned foods. Include foods high in vitamin B12.
Yep. Danielle's got it. Yep. Program outcomes. So we talked about putting together a program, right? For any population. How do you evaluate the outcome? Program outcome evaluation. Did we meet the goals we set out in the beginning? Right? We had goals and objectives. How do you evaluate if you met them? Okay, that's the end of your ADPI. That's your evaluation. Were we successful?
Right.
Right? Were we successful in meeting the goals that we set out to meet? And then primary prevention cancer. Teaching, right? We went through that, we talked about that in class. Think about it. What are some primary prevention measures for cancer? Don't smoke. Those kinds of things. Trying to prevent something before it happens. Okay, so maybe it's with starting out with the kids. What are some teaching strategies for helping patients trying to lower their risk for developing cancer? Okay. Then community outreach, Meals on Wheels, WIC program. There's questions on both of these. All right, and community risks. So Meals on Wheels, we know you know what Meals on Wheels are. WIC program. For community, we need to have a knowledge base of the community resources, right? So who goes on WIC? Who do we suggest that goes on WIC? What's high risk population? They benefit from WIC. And then community risks. I mean, that's so broad. Community risks. I guess it depends on which community you live on. What are community risks? Well, you have environmental risks, right? You have environmental risks, you have safety risks, you have maybe violence risks, That's a pretty broad topic. So, environmental health, neighborhood, what did you put for neighborhood safe houses? Why are those important? And what are they used for? What did you guys put for that? Ariana,
I was looking, is this in module 9? This HESI prep?
pardon me?
I think I have the old version. The one you said you got rid of?
Yep.
I think I have the old one. I've just been like screenshotting these and then writing down as we go, but I'm gonna go back and do more
Okay.
research towards it.
Andy? You there?
Yes, I don't have my, hold on, I don't have it up.
Okay.
I was
Well,
just listening, sorry.
that's all right. Why do we need neighborhood safe houses?
Protection for like the community, so people that might feel like they're in danger, they know there's a place they can go no matter what.
Yep.
So would that be like with abused women, or is that not the same thing?
Yeah.
Okay, okay.
Yeah. Danielle's on top of this. Danielle, why do we need neighborhood safe houses?
Uh, for protection from your abusers, to help them get out of the situation safely.
Yep. Yep. We talked about in class suspected abuse, right? Violence and abuse. And I told you guys that we need to be mindful of the signs and symptoms of abuse, right? Whether it's child abuse, elder abuse. Then we get into home health, hospice palliative care. Okay. Respite care. Doing a home safety assessment. Okay.
Removing all them area roads.
Yeah. Yeah. Home safety can be a whole bunch of things.
Right. I was thinking
Um,
like well lit,
huh?
corner. I was thinking the
Oh,
same, like well lit. House
yeah.
needs to be well lit.
No skid rugs. Is there furniture in the middle of the room? Um,
A lot of hazards.
yeah, the home safety assessment is really important. With infectious disease, pretty clear here, this should all be in your HESI prep, HIV risk factors. It's pretty clear. I mean, right? IV drug, what are the risk factors for HIV? Anybody?
Patient education. I put like proper skin integrity,
Mhm.
patient education, proper promotion of the medication regimen, making sure they stay on top of their medication.
What are the risk factors for HIV? Who's most at risk for developing HIV?
IV drug users,
IV drug users?
I sex, like multiple sex partners, skin integrity, uh, through the breast milk, pregnancies.
Mhm. Yeah.
It used to be blood transfusion, but now they check the blood. So
Yep. HBV active immunity. That I'm thinking that's maybe talking about the vaccine, right? What are the risks for hepatitis A? What are the risks for PID, TB? How do you, I mean, again, think clinically. Think clinically. You're taking care of a client, or you're teaching a client how to prevent, or you're taking care of a client that actively has one of these. And then your vulnerable populations. So if you stick, I guess my point is, if you stick with this outline, these are the topics that have been asked about on HESI. That's why I wanted this to be a term-long project, so that when we got to each of these topics, you could go, oh yeah, okay, I need to fill this out because we covered that last week. Or does that make sense? These are the topics that you're going to see. The questions, I don't know, but these are topics. All right, so I would pull out, well, number one, if you use the older version from week 9, just compare it to week 1. Ariana, it looks like you're doing that as we speak. It's not that different. It's not that different. You just did some extra work if you did the week 9, because I pulled off some topics. What was the other thing I was going to say? And all the same test-taking strategies apply. You have to be able to identify a positive STEM question and a negative STEM question, right? Try and eliminate answers early. Don't change your answers unless you really, really know that you picked the wrong answer. Okay. I always encourage students to read the question without even looking at the answers. See if you can come up with an answer in your head, right? Without even looking at them. What would the right answer be? And then go back and look and see if that answer is there. If you've got a good understanding of this document, you're going to do fine. You're going to do fine. If any of these topics you need to read more about or research more about, go back into your exam study guides, because that will give you more information. Does that make sense? But other than this document and your 3 exam study guides, there's nothing else you need to pull out. Don't overdo it. Okay, these are topics we've gone through. If you were in class, you paid attention, you'll be fine. I mean, there are some of the med surge topics in there, post cabbage, post NG2 feedings at home. We didn't cover that specifically. I get it, but that's part of pulling everything together. Does that make sense? So there are some very focused med surge questions that we didn't. That's pulling from your med surge class, or pulling from your geriatric class. This is why we talk about in week 1 that this class is placed at the end of your program, because we're pulling everything together. And med surge is in the home setting, right? You are practicing med surge skills and pulling geriatric assessment skills, pediatric assessment skills, right? I'm not asking you to go back to med surge and go through all your notes, but it should be seamless. what you've learned in med search should be just seamless as you're coming into the community. Because remember what community care is about, caring for clients in the community. You still need the same skill set, right? So you guys will be fine. You've already learned all this. You'll be fine. But that HESI prep is that's it. That's what's that's what you're getting tested on. So if you've done a a thorough job and have been thinking through these things as the term goes, that's great. If you put it together at the end and had to do it real quickly, well, that just, if that's what you did, that's what you did. But please be mindful that the more you prepare this document through the term, I think the more knowledgeable you'll be. Make sense? You guys will be fine. Last couple of terms I've had, my students have done awesome on the HESI. Okay, this document I think is a really big plus to be doing at the beginning of the term and all the way through. So, and it's not me giving you the information, it's you taking the information you've learned over the weeks and filling it in and thinking nursing process, clinical. Guys will be fine. Fine. And I'm glad you came this morning. Did this help?
Yes, ma'am.
Guys will be fine. I'm going to put out an announcement here in a bit, making sure everybody's scheduled for their HESI. All you guys scheduled for your HESI?
No, I haven't even scheduled mine. I need to.
Okay, but you know
But
when it is, right?
yeah, Friday at 9, next Friday.
Okay, so get them scheduled.
Okay.
Do we have-
Sorry. I have a exam 3 with you on Friday, and I'm going to the library, so it opens up right at 9 o'clock. So like, is it okay if you just give me like a few minutes to get settled? Because I know you'd be ready, but I can't get in there until 9 o'clock.
Into the library?
Yes.
So,
I be on the like I'm on it, but I can't like sit down and show
okay,
you anything until I get settled. But it don't take that long to get settled.
all right, yeah.
I want you to know what I'm doing, because sometimes you be like, "Are you ready, Candy?" And I'm like, "I'm almost ready, but I'm trying to get ready," and I feel like I'm all over the place.
No problem. We'll
Okay,
make
thank
it
you.
work. We'll make it work. Questions. What questions do you have? Take your time with the HESI, read the questions. Look for those important words and cues and phrases. They're going to help lead you to the right answer. There won't be anything, I don't think, on this HESI that you're going to be unfamiliar with. You've done it,
Ow.
you've heard and seen it twice in class, and then when you were filling out this assignment. Guys will be fine. Don't stress.
I have a question. I know, like in the past, we used to have to go in and register for the HESI. Do we still have to register for it?
What?
I said, I know in the past we used to have to go in and register for
Yeah.
the HESI. Do we still have to go in and register for it?
Yeah.
Is it through Evolve?
You should have gotten an email. Go ahead,
I haven't
Ariana.
got anything.
Ariana, go.
Mine, I was about to say, yeah, I did mine through Evolve. Like you just go in, let me see.
Make sure you have the right cohort.
Yeah. Like I had to change mine to January 24. So like if you're January 24, go to your top bar and it's like, it's weird. Like it'll have your name on the side, click your name, and then you'll go up to the top and it has where you pick cohort. You'll do January if you're January. And then it starts to show whatever is supposed to be like up and coming for the HESI. It's weird. I can't explain it.
I'm gonna stop the
So
recording.
is
too.
it okay?